What we have here is some updated information on our favorite drug, RLF 100 aviptadil, the drug that nobody talks about. NeuroRx and Relief announce initial successful results from expanded access use of RLF 100 aviptadil in patients with critical COVID-19 and severe comorbidity, 72% survival seen in ICU patients. NeuroRx and Relief Therapeutics announced that more than 175 patients with critical COVID-19 and respiratory failure who also have a severe comorbidity have now been entered into an expanded access protocol with RLF 100. Remember, they were excluded from the trial. All patients had severe comorbidities such as organ transplant, recent heart attack, and cancer that rendered them ineligible for the ongoing randomized controlled phase 2b/3 trial being conducted to ascertain safety and efficacy of RLF 100, and all patients were deteriorating despite treatment with approved therapies for COVID-19. Of the 90 patients who have so far reached 28 days of follow-up, 72% survived to day 28. And here is where I start to get a little excited. As previously reported by Yusuf and co-workers at Houston Methodist Hospital, 21 patients treated with RLF 100 under the EAP were compared to 24 control patients treated in the same setting. Only 17% of the control patients, all treated with the best available intensive care unit standard of care, survived to day 28. The survival rate with RLF 100 reported today is comparable to that seen among the open-label patients treated with RLF 100 by Yusuf et al. Despite advancements in treating COVID-19, survival for the patients at highest risk due to severe comorbidities has remained dismal in the absence of an effective therapy. Notably, in the EAP, no drug-related serious adverse events have been reported to date among these patients, nor the 160 patients randomized to RLF 100 versus the placebo in the U.S. Phase 2b/3 clinical trial currently underway. Thus, from a risk-benefit perspective, while the benefit of RLF 100 has not yet been proven in a randomized prospective trial, no serious risk has been identified so far. Currently, 25 U.S. hospitals have enrolled patients in the EAP, nearly all of which are community hospitals, small communities, suggesting that RLF 100 can demonstrate effectiveness in the hands of frontline physicians who deliver the majority of care to patients with critical COVID-19. Physicians enrolling patients in the EAP have routinely reported that initial patients at their sites have frequently been in the ICU for several weeks without recovery prior to the treatment of RLF 100. As patients are treated earlier in the course of their ICU stay, there is an emerging clinical impression that RLF 100 has an even greater impact on recovery. I'm going to give you a little bit of history on RLF 100 real quick. VIP is a vasoactive intestinal polypeptide, which is what RLF 100 is classified as. It was first discovered by the late Dr. Sami said in 1970, and forgive me if I pronounced that wrong. That's exactly what it looks like. Although first identified in the intestinal tract, VIP is now known to be produced throughout the body and to be primarily concentrated in the lungs. VIP has been shown in more than 100 peer-reviewed studies, so this has been peer-reviewed, to have potent anti-inflammatory, anti-cytokine activity. Remember, we go into the cytokine storm with COVID. This has been in animal models of respiratory distress, acute lung injury, and inflammation. Most importantly, 75% of the VIP in the body is bound to a rare cell in the lung. My specialty, the type 2 alveolar cell, that is critical to transmission of oxygen to the body. And what is one thing that we don't get with COVID? Oxygen to the body. VIP has a 20-year history of safe use in humans in multiple human trials for sarcoidosis, pulmonary fibrosis, which is what happens with COVID, asthma, allergy, and pulmonary hypertension. One final important thing to note, COVID-19 related death is primarily caused by respiratory failure. Before this acute phase, however, there is evidence of early viral infection of the alveolar type 2 cells. These cells are known to have angiotensin converting enzyme, ACE2 receptors. We've been talking about those for a while too, at high levels, which serve as the route of entry for SARS-CoV-2. There's also big news on the European end because they are getting ready to conduct trials over there in the beginning of 2021. Relief Therapeutics, a biopharmaceutical company with its leading compound RLF 100 in advanced clinical development to treat severe COVID-19 patients, today announced the appointment of Syneos Health, a leading global research organization known as a CRO, to run the European clinical trial in severe COVID-19 induced lung injury, as well as future trials and other indications to be conducted in Europe. Relief has also selected AMRI, a global contract development and manufacturing organization, also known as a CDMO, who will provide aseptic fill-finish manufacturing of RLF 100. So they figured out the manufacturing end. At their Glasgow, UK facility. European clinical assessment of RLF 100 is slated to begin in the first quarter of 2021. Which is also about the time that we are going to start using this in a nebulized form in trial, because the way it's being done right now is by IV. Currently, the stock is still kind of up and down. It's staying pretty stable, but it's going to soar. This is the best hope we have in any of our critical patients because nothing works. Not the antibodies, not remdesivir, not interferon. None of it works in these patients that are this critical. In the meantime, I would like you all to have a very safe and happy Thanksgiving. If you can safely socially distance and enjoy your family, then I encourage you to do so. If you are going to be stuck indoors with every one of your relatives, with very poor ventilation, that is not considered safe, and you definitely should not do that. When you're outside, away from people, there's no need to wear this. However, if you're going to be out near people within 6 to 10 feet of distance, then you do need to wear it because this reduces the viral load that you are exposed to. And we know, because science, that your symptoms will be very minimal if you're not asymptomatic when you are exposed to a low dose of the virus. So please, be safe, be smart. I know we are all tired of hearing stay at home. I know we are tired of lockdowns and shutdowns, and we cannot continue to live like this. But we do need to come together. Community unity, folks, and just follow the guidelines so we can be done with this after cold and flu season. Please.